So good morning, and thank you for coming to the release of the 2022 AMA Queensland Resident Hospital Health Check results. This is the 7th year that we've run the survey, with the first one taking place in 2016. Unfortunately, this year's survey shows little improvement, and generally things seem to be getting a little bit worse. There's been a small drop in bullying, discrimination, and harassment, which is really good to see. But unfortunately, 3/4 of junior doctors are still worried that reporting bullying and harassment will have negative consequences on them in the workplace. In our first survey in 2016, 60% of junior doctors reported being satisfied with their clinical teaching. In this survey, only 25% report that their clinical teaching was adequate. This survey also highlights that fatigue is a growing concern. 3 years ago, around 50% of junior doctors reported being worried they'd make a clinical error due to their fatigue. This year, that number is close to 60%. And this is obviously a very concerning trend. Our trainee doctors work excessively long hours under very challenging conditions. Appropriate training in formal and bedside teaching is critical for the medical profession to provide specialist medical care now and into the future. We need to train these doctors well so they can be the cardiologists, the respiratory physicians, the surgeons, and general practitioners that Queensland need in the years to come. A culture of fear that stops junior doctors from speaking up about bullying is a culture that does not allow them to advocate properly for their patients. If we don't take action on this, and if we don't see some improvement, we are concerned that the medical workforce will continue to be under significant pressure and that we won't have the doctors that Queenslanders need in the future. Now I'd like to hand over to AMA President Dr. Maria Bolton to say a few words.
Junior doctors are our future. They're the ones who are going to be specialising and looking after us as GPs, as cardiologists, physicians, surgeons, and it is so important that we look after them and their training needs so that we have that workforce into the future. Tomorrow, Queensland Health will be hosting the Workforce Summit, and we will be taking the results of this survey with us tomorrow and making sure that the voices of junior doctors are heard and making sure that we are part of the solution moving forward. We're particularly concerned about the survey results saying that up to 60% of junior doctors are worried and concerned that they will make a clinical error because of the strain that they are under. We know that our hospitals are under strain. We know there's ambulance ramping. We know that there is lack of access to hospital beds. And this strain is being felt by all healthcare workers, from senior doctors, junior doctors, nurses, allied health, and also general practitioners. And it is essential that Queensland Health develops some urgent solutions to ensure that Queenslanders have access to medical care, not just now, but also into the future. Thank you. Take some questions.
Maybe Dr. Robert, you would be experiencing some of this stress that's been reported in this report. What kind of a toll does that take? What's that like for you?
It takes a big toll. So for me, I have my fellowship examination coming up. So I spend a lot of time at work, and then when I'm at home, I spend a lot of time studying. Because I'm an emergency medicine trainee, I do a lot of shift work. I still manage to see my wife once or twice per week. And hopefully that will increase after my exam. But it does take a really big toll. I've been looking after patients in the emergency department that are in the department for an extensive period of time, sometimes over 24 hours. And that takes a big mental toll to want to provide care for people in the waiting room, to want to get patients off the ambulance stretchers into the emergency department, and be struggling to do that because we don't have space in our hospitals to get people up to the wards.
What do you see as the solution to the overworking, the long hours? Is this a problem with not having enough doctors? Is it a problem with not having enough beds? Or is there another solution here?
I think it's mixed, and it's a complex problem, but we definitely need more doctors in our public hospitals. Queensland Health has committed to building 2,500 new beds over the next 6 years, which is a great step because we need more public capacity. But we also need to remember that beds don't treat patients, people treat patients. And what we need to see is Queensland Health taking an active role in looking after their people so that we can keep looking after Queenslanders.
Are doctors leaving because they're stressed and tired and saying, and worried about hurting someone and saying this isn't worth it?
So we don't have specific numbers in that area, but it's definitely something that we're hearing more and more from our members, that they are resigning and leaving for other opportunities and not engaging with the public health service anymore. And that's definitely a worrying trend, particularly if we lose our junior doctors from that training pipeline and they're not, engaging with training in our public hospitals because they're just not receiving it enough, and they leave the state or leave for other opportunities, because it does put that future specialist workforce in jeopardy.
Maybe one for Maria. With the summit tomorrow, do you know, I suppose from a Queensland Health level, who's going to be there and sort of how, whether that summit could actually lead to change? Are you confident that that sort of consultation is...
AMA Queensland has been invited to be part of the summit tomorrow. We know that there's other organisations that have been invited. We know that some of the medical unions will be in attendance. We also know that there'll be some colleges and also Queensland Health, of course. We hope that the conversations that we have tomorrow do lead to some change. AMA Queensland is always happy to be part of the solution, and for example, we developed an AMA Queensland ramping roundtable, and we did provide some recommendations to the state government last year. Some of them were taken up, for example, more hospital beds, but some of them weren't, and we're certainly looking forward to working with them tomorrow, providing some solutions, but also we need to see action on those solutions because we've been waiting for far too long. Our system has been under strain since before COVID. We really need to stop using COVID as an excuse, and we really need some urgent action. Some of the 2,500 new beds that have been announced won't be a reality for at least 6 years, and that's going to take far too long. So we are looking for urgent action there. We know that for every hospital bed, you need 10 staff to staff that bed. So that is why it is so important to ensure we have enough staff moving forward, not just for those beds, but also for the needs today.
If we don't see those changes, happening quite soon, what's going to be the outcome?
Yeah, we're very privileged in Australia. We do enjoy some of the best healthcare in the world, and what will happen is that if our system continues to be under strain, if our system continues to be neglected, that healthcare will drop off and it will be patients that suffer, and that is why it is so important to turn it around.
How do you sort of summarise these results, saying that staff are tired, overworked, stressed and worried about making a mistake and potentially doing patient harm? It's pretty scary.
Yeah, these results are not news to us, and this is something we're hearing from all levels of the hospital staff. It's not just junior doctors, but senior doctors, nurses, allied health workers who are under strain. They're feeling it the same way that, we're seeing ambulance ramping, we're seeing lack of access to hospital beds, and everyone's feeling it at the moment. And the saddest thing is that it's affecting patient outcomes, and that's why it is essential to turn it around for the patients.
If you're a doctor who is into a 40-hour shift or something and you make a mistake, essentially that's still on you, isn't it?
Correct. Doctors, they've been amazing. Like every other healthcare worker during the COVID pandemic, doctors have been standing up, they've been showing up to work. I know many GPs who've actually worked from home when they've been sick, trying to do their bit during the pandemic. But they are fearful that because they're under so much strain that they may make a mistake, and it is on them. But the worst thing would be for them, they don't want to make a mistake. They want to keep looking after the patients the best they can.
Can I ask you, Dr. Nair, another question?
Of course.
Given all of this, why do you do it?
I love my job. I really do. So when I decided to do medicine a bit later in life compared to many, my first degree was actually in business and accounting. And what I realized was that I had a passion for helping people. When people come into the emergency department, for a lot of them, that's likely one of the worst days of their lives. They're in pain, they're scared, and they're worried. And they're worried about themselves, they're worried about their family, and all of their loved ones. And I really enjoy being someone that can help alleviate that pain that they're feeling and help them through one of those really difficult days in their lives, and do what I can to help make them healthy and better. But to do that, and to do it effectively, I also need to be supported in my job, and I need safe supervision and good clinical training to help grow my independent practice so I can help people in the years to come as well. So that's why I do this. That's why I'm here.